Good evening. This is the February meeting of the Pitt County Board of Health. I call this meeting to order. At this time, we will open the floor for any public comments. If anyone has public comments to make, come forward at this time. None appearing. We'll move on to the minutes. We are lacking a quorum at this time, so we will review the minutes, but we will have to wait to approve those minutes until hopefully we get another member showing up, so we'll have a quorum. Does anyone have any changes, additions, or corrections to make to the minutes at the present time? If there are none, we'll hold on action on the minutes until we hopefully have a quorum. If we do not have a quorum, we'll carry this over till next month's meeting. Fiscal report. John, if you would, Mr. Reed, could you give us a fiscal report?
Thank you, Mr. Chairman. Good evening. The financial report you have in front of you is for January 31st. So that's 7 months into our 12-month fiscal year, which ends June 30, 2013. The trends that I have reported on at previous Board of Health meetings really continue. Not a lot of changes. You'll see on the report that our Medicaid and clinic fee revenue is trailing our budget. That has been a trend we've seen all year, and that trend will most likely continue. The environmental health fees are trailing the budget. However, we are coming up into the warmer months where we're going to have more activity out in the field, so that probably is going to get closer to our budget number and true up, hopefully by June 30. Department of Health and Human Services and the Environmental and Natural Resources State Departments, while the revenue is trailing the budget, again, just to remind you, that is just a reimbursement of expenditures already incurred. So the fact that the revenue is below budget also is just a reflection that the expenditures to those programs is also below budget. The county funding, in January, they transferred the entire third quarter funding, 3 months funding, to the health department. So you'll see in the timing column, I've backed out 2 months of that funding just to true that up. And in the other row, you'll see I've added in the timing column about $20,000 to reflect some revenue, some expenses we've incurred for private grants where the money will not receive it until February. Some of that money we've already received in February as we speak. So if we were to close the books today, we would use $90,590 of our fund balance to balance operations, which is about a third of the fund balance we budgeted this year. We budgeted $288,000. So I went back just to see where we were as far as a deficit or a surplus last January, and I couldn't find a Board of Health report for January 31, 2012. We may not have had a meeting then, so I looked at February, and we're about at the same place we are. So, year on year, as far as the deficit and surplus goes, we're about where we thought we would be. We're going to try to really delve into this, the Medicaid and the clinic fees, try to get a better handle on that and get that truer, closer to the year end by June 30. But it really is just a reflection of the activities. I'll be glad to answer any questions.
Any questions? Thank you, Mr. Reed. We do now have a quorum, and so I declare a quorum, and we can approve the fiscal report. Do I hear a motion?
So moved.
Second?
Second.
We have a motion and a second. All in favor say aye.
Aye.
All opposed? Thank you, Mr. Reed. Let's go back to our minutes, if we would, please, now that we have a quorum. Do I have a motion to approve the minutes for the January meeting?
So moved.
Do I have a second?
Second.
We have a motion and a second to approve the minutes. All in favor say aye.
Aye.
All opposed? The minutes stand approved. This time we'll move into old business. And we have a report for the NACHO governance functions of Board of Health. This is a piece that we looked at last meeting. And Dr. Morrow, would you inform us what we have here?
Yeah, thank you, Mr. Chairman. These HO governance functions are from the National Association of City and County Health Officials. And I brought these to the board last month just for consideration and possible adoption. They actually lay out the functions of boards of health. As you know, we have a long history of having the oldest boards of health, local boards of health in the whole country in North Carolina here, and are real proud of our public health system here in North Carolina. But I thought these 6 functions, as they're laid out, they're policy development, resource stewardship, legal authority, partner engagement, continuous improvement, and oversight as those functions, and it lays out more detail in terms of what those are about. But I just wanted to bring these to the board for consideration for adoption. I think they're good in terms they're similar to the 10 essential functions that we use as the health department in terms of what our role is. They're very broad, very inclusive, but I think they delineate well the difference between what the board does and what the agency does. So I bring them again for your consideration. I don't think you need to incorporate them into the operating procedures or the bylaws. What we used to call the bylaws are now operating procedures. But I would suggest that you just adopt them separate as governance functions for Pitt County Board of Health.
Is there any discussion?
We need a motion.
We would need a motion to adopt these as our board governance functions.
So moved.
I have a motion and a second. All in favor say aye.
Aye.
All opposed, nay. So we will adopt these as our governance functions for this board.
Thank you,
Thank you.
Mr. Chairman.
So grant application updates.
That's me, too.
That you too, Dr.
sir.
Morrow?
I mentioned last month we were in the process of making an application to the Health Resources Services Administration. It's a federal department for a large grant that would be up to $500,000 a year for 3 years. We did submit that grant last week after a lot of hard work by our staff. But I'm happy to say it got in. It got in on time, and it was complete. This is a grant around public health nursing, retention and recruitment, and it increases the integration between public health and primary care. We're partnering with the ECU Department of Family Medicine for primary care of adults with hypertension, diabetes, and high cholesterol. Those are the most common things that we see today in our adult population, and with our current situation of adults who are not Medicaid eligible and don't have insurance, that's a lot of what the health department and a lot of what our emergency room and a lot of what our clinics are doing, free clinics, and as well as our federally qualified health centers and other clinics in the areas are treating adults with hypertension, diabetes, and high cholesterol, or the outcomes of those diseases. So that's what this grant would approach and try to improve services for. It would use a very sophisticated electronic health record and use health screening kiosk as well as smartphone applications are some of the things that we put into the grant. We got support from the ECU College of Nursing, the ECU School of Medicine, Vidant Medical Center, the Eastern Area Health Education Centers, Eastern AHEC, as well as the State Division of Public Health to help us put this grant together. So we have our fingers crossed. We won't find out won't get notified whether we receive the grant until probably this summer, sometime probably July. And if we are funded, we won't receive funding until October. So the grant would be from October of 2013 through September of 2016. So that's the biggest grant that I wanted to bring you up to date on tonight. We also submitted letters of intent for 5 grants to the Vidant Medical Center Community Benefits Foundation. And so those were for our Farmers Market Nutrition Program that we've run for several years now, the Diabetes Self-Management Program, an in-home breastfeeding program, and breast cancer screening and mammograms, and our maternity fair, Making Pitt Babies Fit. I also submitted a letter of intent for that. We'll find out about those grants this spring, and funding for those would start in July. So that's where we are with the grants.
Any questions for Dr. Morrow? Thank you very much for that update. Is there any other old business before we move on to new business? All right, none appearing. New business, item for discussion is Medicaid expansion. Dr. Morrow?
Again, Mr. Chairman, this is something I mentioned, I think, last month, but we weren't sure exactly where this was going. The news today is that Governor McCrory announced this morning that he is not supporting a Medicaid expansion for North Carolina. There's been a lot of discussion in the General Assembly. I think it's important that folks here in Pitt County understand that this can have a huge impact on our public health department. Those people I was just talking about that we're seeing with chronic diseases like hypertension, diabetes, high cholesterol, obesity, all these health issues potentially could be covered under Medicaid expansion. We have one of the best Medicaid programs, I think, in the United States here in North Carolina. And as I understand it, we're going to give up about $15 billion in federal tax dollars, or our North Carolina tax dollars that we've paid to the federal government, not coming back to North Carolina if we don't expand Medicaid, but instead going to other states across the country to pay for their health care. In the meantime, we still have the patients who need the care, and we'll do as we've been doing in the past. When folks are uninsured, we have to provide them care. So this, I think, is a huge opportunity. If we don't expand Medicaid, it's a huge opportunity missed for North Carolina, and particularly for public health. Public health departments are struggling across the state, trying to improve the health of the people in this state, all the people in this state. And without Medicaid expansion, it's going to, I think, make our job even harder to do. So I'm, as you can tell, I'm very disappointed in what's being happening in Raleigh right now. The Senate has already decided not to expand Medicaid, as well as not create a Medicaid or a health insurance exchange. Those are two different issues. So I don't think people should get them confused. The health insurance exchange, if North Carolina doesn't do, then the feds will do for us. So the choices there were either we do a health insurance exchange, the feds do a health insurance exchange, or we go together and we do it as a partnership. So when North Carolina decides not to do a health insurance exchange, that just means the feds are going to do it for us. That's totally different with Medicaid expansion. If we decide not to expand, it's not done. It doesn't get done by the feds. Nobody does it. And we end up with more uninsured. The number of uninsured continues to grow, and less ability to take care of them. So this is critical to public health in North Carolina. It's critical also to the hospitals. It's critical to our medical school that depend on Medicaid payments also to care for these folks. So I'm very disappointed. I think our hope now is in the House of Representatives that they can see their way to changing the mind of the General Assembly and the governor to make a better decision, I hope.
I've been following this in the news, and just for clarification, I think that the rationale that I have heard, and this may be incorrect, is that the Senate leaders or the legislative leaders felt like, although the federal government was guaranteeing that we would be reimbursed certain amounts of money, that they could later change their minds and not reimburse that money, although I'm not sure that that's a likely scenario to play out. But is that, as you see it, is that sort of the argument that they're making, is that we would make a commitment that later on the federal government could fail to fund it to the levels that they are saying that they will fund it?
I've heard that too. I don't think that's a very valid argument. I think that if that were to happen, that I think we could pull back. The guarantee right now is for 3 years that the federal government would pay 100% of the cost. So right now, we're sending North Carolina tax dollars to Washington that for the next 3 years will be going to some other state to pay for their health care. And then after the 3 years, 90% of it is paid by the federal government. So unlike our current Medicaid, which only pays about 66% of the dollar, the feds pay about 66% of the dollar. This was 100% federal dollars. Now, granted, some of those dollars are North Carolina dollars, but as it stands right now, we're sending those North Carolina dollars to another state. So I don't see the wisdom in that choice. Personally, I'd like my North Carolina tax dollars to come back to North Carolina.
Dr. Johnson?
In your opinion, what is the possibility of a change in Raleigh in their decision?
I really don't know, Commissioner. I think it's a tough change. The Senate seemed to be very committed to this. The governor seems to be very committed to this. I don't know what will happen to Medicaid if this decision is made. I don't know what other decisions may be made that could harm our Medicaid program here in North Carolina. We've had, like I said, one of the best Medicaid programs in the United States. I think if you look and ask anybody that knows anything about Medicaid, North Carolina has been a real model. And I think we've done a good job of partnering with Medicaid. Public Health has done a good job of partnering with Medicaid over the years to make wise choices and to be efficient. The recent deficit in the North Carolina Medicaid budget, I think it was clear from Secretary Chancellor 3 years ago that budget was unrealistic. And he told the General Assembly that 3 years ago, that there was no way that we could make that budget. So I don't understand why the General Assembly seems surprised today that there's a shortfall in that budget. But I think going forward, even with 100% federal dollars paying for the 3 years, after those 3 years, I think most people will tell you if we look hard, we can probably find the 10% to pay that difference after the 3 years, so the state still wouldn't have to kick any more money into this process. And if the feds pull back, then, yeah, I think the rules of the game change and North Carolina makes a different decision at that point. But I don't think this decision by the Senate today is a wise one.
Dr. Morris said for the public, this would mean that there would be more uninsured people who would have to then seek service from the emergency department rather than primary care.
Well, they'll be uninsured, so we're seeing growing numbers of uninsured. This would step in and insure a lot of those adults between the ages of 21 to 64 years of age before they're eligible for Medicare.
Right.
And they're not eligible as children for Medicaid. This would help insure some of those people now who are not insured and who don't receive primary care, the vast majority of them, because they're not insured. We know that folks with insurance access preventive and primary care services much better than those who are uninsured. And so a lot of those uninsured people, we're paying at the back end because they don't go to the doctor, they don't receive preventive health services, and so they show up in the emergency room by ambulance with a critical illness and wind up in our intensive care units and cost thousands and hundreds of thousands of dollars to care for with no insurance to pay for it. And so that's what our hospitals are struggling with, that's what our medical schools are struggling with, that's what our physicians are struggling with in the community as well as our public health system. And this just makes it worse.
Is there I know for the public that's watching out on TV, is there I'm sure you would like for them to reach out to our General Assembly members and maybe convey their thoughts on this issue if they have strong feelings that perhaps the Medicaid expansion should indeed happen for all these reasons that you've given us. Is there something that this board could do, or would you feel like that would be appropriate at this time?
I think the board could draft a letter to the General Assembly, to our House of Representative members, if you like. I'd be
Okay.
glad to help with that.
Discussion.
Dr. Morrow, I have a question. What is the reaction from the other health departments on this situation right now with Medicare? I know that you are frustrated and you're very concerned about what's going on, but what are the reactions from other health departments? Have you heard anything?
I think the health directors that I've talked to about this issue, I talked with a lot of the leadership in public health last week. They're extremely distressed by the possibility that all this funding that could go to help public health and here in North Carolina would go to other states. I think that's the bottom line. I think, that we're all concerned about the federal deficit. We're all concerned about our economy, but not taking care of particularly of poor people and poor health is no way to improve our economy. We're really talking about, spending money at the tail end of illness versus getting people primary care and getting them preventive services that saves money. It's the equivalent of what we always tell people of taking care of your car. You don't wait till it completely falls apart. You change the oil. And it's similar to that with health care. And unfortunately, we're spending a lot of money just trying to put people back together when they've not been taken care of for many years. So I would say that I don't know of a single health director in this state who doesn't support this expansion of Medicaid, as well as the hospital directors and the medical schools. And I don't know of any physicians, actually, that don't support Medicaid expansion. There probably are some, but I don't know.
Okay. Dr. Johnson?
Should this board decide to send a letter, shouldn't we also send it to the Senate in that in the final analysis, they're going to need to work together. In other words, the North Carolina House will not be able to carry the entire burden.
That's right, Dr. Johnson. That's a good point. Yeah, I would agree.
So, do I hear a motion that we have Dr. Morrow prepare a letter stating the support of this Board of Health for the Medicaid expansion and send that letter to our legislative leaders as well as the governor?
So move.
Do I hear a second?
Second.
All in favor say aye.
Aye.
All opposed, nay. It is approved.
Mr. Chairman, I'll just add that we are, our health directors in our region, this is Region 10, are meeting with our legislative group this Friday in Kinston. So I'll have an opportunity to speak to some of those legislators this Friday about this issue, I hope.
Very good. Thank you, Dr. Morrow.
think we should also express appreciation for Dr. Morrow for staying in touch with what's happening. I recently went to Raleigh and with preparation for the legislative agenda for the North Carolina Association of County Commissioners, and that's extremely hard work. I knew it was going to be difficult, but I came home exhausted from the necessity for making the necessary contacts, and it takes a lot out of you, and I think Dr. Morrow deserves our praise for working with the key members who will be making the decisions.
I agree.
Thank you.
Thank you very much.
I will also, as the president of the Health Directors Association, I'm going to be meeting with Secretary Vosh next week. So we'll probably address this issue again next week if we can with her.
Any other new business today? If not, we will move on to the Health Director's report. Dr. Morrow?
I just wanted to update y'all on what's going on with influenza. As everybody knows, it's been an early and pretty severe season with flu this year. It's been more severe than the last 3 years. Our most recent report from last week shows that most of the flu has been type A flu, H3. We have had some type B here in North Carolina. As you know, the vaccine contains 2 type A strains as well as 1 type B strain, and it does appear to be pretty well matched this year, the vaccine is, but we have seen a lot of influenza early on, and we think that because it came early, that's one of the reasons, because there weren't as many people vaccinated yet, that we saw an early spread. So hopefully we can get more people vaccinated early on next year in October. Right now, influenza-like illness is decreasing across the nation. That's the good news. North Carolina is considered at the regional spread level, while if you look at a map of the United States, most of the rest of the country is still at the widespread level. We've been at regional now for, I think, 3 weeks. Unfortunately, so far there have been 59 pediatric deaths in the United States from flu this year. Fortunately, none of those are here in North Carolina. We have, though, however, had 37 deaths so far here in North Carolina in adults. Most of those have been in the age greater than 65 years of age. But I would just caution you that those numbers are preliminary. We always see those numbers climb as later reports come in. So I expect that number to be much higher by the end of this season once more data comes in. But it looks like, at least, that we're seeing a significant downward trend in influenza, and hopefully that will be our flu season for the year. But just caution folks, if you've not been vaccinated, it's not too late to get vaccinated. We do have free vaccine at the health department. We'll be glad to administer to anyone over 6 months of age, and it's free. And we still have some in supply, and we may be able to get some more if we run out again. We've run out several times. But it is possible for another wave of flu to come through in this season. So, and no one can predict that, unfortunately. We've never been able to read that flu crystal ball that well. So, if you've not been vaccinated, it's not too late to get vaccinated. And with the type B flu being out there as well as type A, those people who got type A flu but haven't been vaccinated are still susceptible to type B flu. So even if you had flu, if you're not vaccinated, I would recommend the vaccine, just to be safe.
All right. Anything else?
That's all I have to say.
Very good. Do I hear a motion? We adjourn.
So moved.
Second.
Second. All in favor, say aye.
Aye.
I declare this meeting adjourned.